doesn't make a big difference, I think.
Hey,
Is it ready?
you're live.
Okay, hey guys, it's Dr. Emer, and I'm very lucky. I have a patient here today that has scarring, and he's letting me show you really quickly what we're doing. We're using one of the newest treatments called the Vbeam Prima. You can see here it's one of the newest Vbeam devices. This is still the gold standard laser to shrink scars that are thick. This is also used for many other things: blood vessels, veins, scars, redness, rejuvenation, pigmentation. There's a lot of things if you know how to use this device. I've been using this device since 2006. So I want to age myself, it was about 13 years. And before, the device was really big. Now it's sleek, it looks a lot nicer, it has a touchpad. But the point is that the hand pieces allow you to customize how you treat these scars to almost the millimeter level. Also, you can see on these scars, you can see how dark blue they are. In the old days, the energy could not get that strong. We weren't able to penetrate that deep, so a scar like this would take 10, 15 treatments. Above here, we've already treated one, and you can see, like, look how smooth when I press the skin. Even though it's still there, it's soft, but when I press here, look how hard. So that means they're already shrinking in one treatment, when normally that result would have taken us 3 or 4. So he's doing very well with this newer device. I'm going to show you what it does. It penetrates really deep into the skin, right when I was about to do it. Recalibrate, hold on. Okay, it penetrates really deep into the skin, but specifically targeting, very quick pulsing the scars themselves. And there's a cooling spray that's sprayed at the same time so that it's a little more comfortable and also protects the surface of the skin. Now the goal here is to get them to be a darker color so they shrink in size. Otherwise, you literally will be doing tons and tons of treatments without a result. So even though people will be trained not to do double pulses and things like that for safety purposes and scars, this is what you have to do. Otherwise, you just will not get a response. And our goal is to shrink the scars so that we can later laser them, or just so he feels more confident without them sticking out in his clothes or touching them or scratching them. You know, it's a bother to people. You can't really use a lot of numbing, unfortunately, because it can interfere with the laser's result. So we are using some oxygen and nitrogen gas to help. It's doing really good. I'm still going to go over some of the areas that don't have as much of a keloid, just to help the overall look of the skin. Is anyone asking anything?
They're asking no nerve blocks.
No, you can't do nerve blocks on these. We need the laser specific penetration. I don't want it interfered.
They're asking what are these scars from?
It's bad acne, you guys. This can happen in some patients, and also when you have different skin types, my African American patients, my Asian patients. And so this is one of the things, my life's goal is to create a non-for-profit where I can give patients like this free treatments, or my nursing staff can, because I really want them to be able to get confident again.
Are you able to use this laser for stretch marks?
You can, it's just not going to do as much for stretch marks unless they're red. So for red stretch marks, it would work really well, but for non-red stretch marks, it won't. So if we take a look, you can see the discoloration. That's very good as compared to this side, which we haven't done yet. You see here that purple color is what we want. Almost all these are that color. We're going to work a little bit more on these.
Is there any downtime for this laser?
Not really, it's just going to look bruised, you know, I mean, it just looks discolored. Sometimes you get a little scabbing, not that much. You're halfway done.
They're asking, have you done Keloid injections on those hypertrophies?
Yes, we're going to do that actually right after this today. I usually tell people by 3 treatments we really know how successful it's going to be.
Can scars disappear totally?
No, you'll always, at the best, we'll probably get to this level here. At the best, this is where we'll get, but then we can laser a different type of laser to get more improvement. My goal is to do the best I can, and hopefully he'll never have any acne that would flare this up again. We're almost there. But you guys see, cosmetic isn't always aesthetic like you're thinking about. This is also medical. You know, this is life changing for somebody. And unfortunately, there's not a lot of people that know how to do these types of treatments. So I'm hoping that we get really, really, really good for him. Okay, you guys, so that's using the Vbeam Prima for hypertrophic scarring, keloids, and acne, and we'll follow him as the time goes on, but he's really going to get a nice improvement. All right, halfway, just make sure to do me a favor.